As I wrote prescriptions over the last couple of days of surgery, I'm reminded of all of my patients who had an aha moment whenever I told them about these resources to save them money on prescription drugs. Not having this information can potentially cost you tens of thousands of dollars every single year if you're one of the 131 million adults in the US who use prescription drugs. For those of you who do not know me, my name is John Lin. I'm a urologist, also an occasional YouTuber, public speaker on the business of medicine, angel investor, and I like to think an all-around nice guy. If you have any questions or comments, please feel free to leave them below in the live stream, or if you're watching this on replay, I look forward to getting the information and questions from you. I'm going to talk about 4 different ways to save money on prescription drugs. Now, this may, among my peers, I guess my followers range from younger folks to older folks, so this may not apply to you right now, but it may apply to your parents who qualify for Medicare. You see, Medicare requires prescription drug plan. This was started back in 2006, and to help Americans navigate this maze of which plan do you choose, Medicare.gov actually has a plan finder. So this is called Medicare Part D Plan Finder, medicare.gov/plan-compare. You can actually change your Medicare prescription plan every single year. And there's a short, well, not so short, depends on how you look at it. From October 15th to December 7th, you can change your Medicare Part D prescription plan. Now, why would you even think about doing that? Don't you just pick a plan and then stick with it? No, actually, on average, there are about 25 plans to choose from for every American eligible to get on one of these plans. You want to pick and change these plans depending on the type of medications that you're on, because different plans have different coverage. Yes, I know our system is totally screwed up, but that's the way it works for those with Medicare. You are actually required to have a Medicare Part D, and you are penalized for not having a Part D plan. I know, it's crazy, right? Only about 30% of Americans, or only about 30% of Medicare eligible Americans use this Medicare Part D plan finder. It actually saves you a lot of money. So let me show you how this works in this brief demo. If you go to medicare.gov/plan-compare, you are brought to this page. Explore your Medicare coverage options. So you figure out, okay, well, here's my zip code, 85297. I'm going to click continue. And I'm going to talk about Medicare Part D drug plan. So I'm going to click on find plans. And yeah, this is kind of confusing. I'm not going to deal with Medicaid. I'm not going to talk about supplemental security. I'm actually going to pick Medicare Savings Program. And then I'm going to click next. I've already loaded a few medications, a cholesterol medication, a medication for overactive bladder, and medication for erectile dysfunction. And if you want to add a drug, you just kind of click here and pick maybe, oh gosh, Carvedilol. You don't even have to type it all the way out. You can just type CARVE and it's going to allow you to pick. So I'm going to pick Carvedilol, which is a beta blocker. Click on add drug, pick the dose, and pick how many. Usually this is prescribed 2 times a day, so you need 60 every single month. So you click add to my drug list, and there you go, right there. So you have 4 different drugs that you currently take, and you click on done adding drugs. And this makes a difference because depending on the drugs that you're taking, the plans will cost differently. The cost varies depending on the plan that you choose. Okay, then you pick 5 pharmacies near you, near 85297 where I'm located. You can click or choose a preferred pharmacy if you have allegiance to a pharmacy, or you can just say, I'm just going to click on these pharmacies. You can also choose mail order pharmacy if you wish. So you can click here if you want. But here's Walgreens. I added Walgreens already from a previous login. Walgreens, Fry's, and you can pick maybe CVS Pharmacy or Costco, right down the street from where I am. One of my happy places. So 10 are listed here, but you have more choices down here if you wish. And here's a map of where they're located relative to where I am, 85297. And then you go down to the lower right-hand corner and click Done. And it'll load. It thinks for a second. Great. Maricopa, Arizona, that's my location. Plan type, you can pick if you are a part of Medicare replacement plan, you would click here, or you can just look at just prescription drug plans. That's what I want. You can pick by insurance carrier if you're partial to a particular Medicare Part D insurance carrier, or you can just leave it blank. Star rating, just like buying anything online, you can pick, okay, I'm going to pick insurance plans that are 3 stars and up, and I'm going to click apply. A lot of happy customers, great. I'm going to use that as social proof and implied endorsement. And you are listed here showing 10 of 12 drug plans here. So the way to look at this is monthly premium. There's a monthly premium, and this is $7.50, includes only drug coverage, or if you are taking into account the cost of the medication plus the premium, because there's an out-of-pocket cost to the drugs that you're prescribed if you plan to buy them through this program, through AARP, Medicare, RX, Walgreens from UHP, United Healthcare, prescription drug plan. Every month, it will cost you $190.40 by going through this plan. And you can certainly go down here, Humana, $525.70 every month for the 4 medications that I picked, that I included for these plans, for this program, for this website, to look at the cost. So you get the gist. You can keep going down here, $560, $13,000, which is outrageous, $13,000, the outrageous amount. The medication that is costing a lot is Meribetriq, which is branded. It is not generic. So that is why the costs are so high. But interestingly, you can get down as low as $190. So again, depending on the plan that you pick, it ranges from $190 per month to tens of thousands of dollars a month. Yeah, crazy. Sorry, $13,000 for the rest of 2024, not per month. That's the total drug and premium cost. Crazy amount of money. So that is Medicare Part D Plan Finder. Shop around every single year for the best plan, and you can change every single year. Your enrollment period is from October 15th through December 7th. Okay, that's the first one. Second, Mark Cuban, costplusdrugs.com. www.costplusdrugs.com. Mark Cuban, the owner of Dallas Mavericks basketball team. He's a businessman. You probably know him best as one of the hosts on Shark Tank, one of the sharks on Shark Tank. So this particular website does not take insurance. So that's the downside, but it is very affordable. They take only cash. Most of the medications that he provides through that website are generic drugs, not branded. However, recently there are some brand medications coming online. His model is that he places a 15% markup on a medication plus a pharmacy fee of less than $5 and less than $5 for shipping. Physicians like me can directly send the prescription to the Mark Cuban's Cost Plus Drug website pharmacy. The delivery takes about 5 to 7 business days. So if you need a medication right away, this is probably not a good option. But if you have a chronic medication that is generic, especially, Although, again, some branded medications are coming online through this website, especially generic medication. You should definitely price compare and shop on the website, on Mark Cuban's website. All right. Third money saving pharmacy is Amazon Pharmacy. Of course, Amazon is in play. This was actually started in November of 2020. Sign up for the pharmacy program is actually free. But of course, like a good capitalist, Bezos has set up so that you have more significant savings with a Prime membership. Did you expect anything less? The good thing about Amazon Prime or Amazon Drug or Amazon Pharmacy is that it does take health insurance. That said, once you send a prescription in, it does take 4 to 5 days without a Prime membership and takes a couple of days with Prime membership. So I think this particular venue is good for chronic medications that you take on a long-term basis, and probably not too good if you need pain medication, if you need an antibiotic or something like that. So if you can plan ahead, it definitely has the potential to save money. Amazon Pharmacy also has a feature called Pill Pack. If you are taking multiple chronic medications, pill packs are individually labeled by date and time to help you be compliant with your medication, if you will. These are personalized packets. Pill Pack program does take 2 to 4 weeks before they can get the pill pack medication to you. My thinking is, well, that's great if you know that you're going to be taking this medication chronically, say for the next year. But what if you see a primary care doctor or your cardiologist, and the medication regimen changes? Then what? You have all of these pre-packed medications. Most likely, these are just medications in small packs, and you don't know what the individual medications are unless you look online to identify each medication and then switch them out if you have a new dose or new medication added to your regimen. So if you are taking medications chronically and you know it's not going to change for the whole year, then the Amazon Pharmacy Pill Pack feature may work for you. Amazon, of course, has something called RX Pass. For $5 a month extra, it allows you to refill generic medications at no additional cost, and you don't need to go through insurance. It is unfortunately not available for Medicare or Medicaid patients, and also not available in certain states such as Texas, Pennsylvania, and California. So I guess look around, look at RX Pass and see if that helps you out if you are not on Medicare, Medicaid, or you are not in one of those states that prohibits RX Pass. Lastly, one of my favorites, and this service has saved a lot of my patients a ton of money, and that's GoodRx, goodrx.com. This is actually started by a few Facebook engineers. It is a free online tool that compares generic and brand prescription drugs at your local pharmacies, and you can compare cash price, meaning you're paying cash out of pocket, versus the cost going through insurance. I can't tell you how many of my patients have told me that it's cheaper for them to pay cash and buy medications through one of the pharmacies that they seek out and identify through goodrx.com instead of going through their insurance. I know it's crazy, but that's the way it works. GoodRx is actually good for medications that you need immediately. Antibiotics, for instance, antibiotics after surgery, or if I prescribe medication for pain medication that you need after surgery, you can tell me the pharmacy that you prefer after consulting with goodrx.com, and I can send it to that pharmacy, which saves you the maximum amount of money. But you do need to let the doctor know that you want the medication sent to that particular pharmacy. So let's check out goodrx.com and see how that works. All right. Let's see. Let's start over. Go to goodrx.com. Pick a medication such as generic Viagra, also known as sildenafil, and you want to pick the right dose. Typical dose will be maybe 50 milligrams. I'm going to prescribe 30 tablets. So 50 milligrams, 30 tablets, using a standard coupon is about $16. And of course, if you go through GoodRx, $4.99 with their special offer. Pricing with GoodRx coupon is $16. Look at the variability. I want you to pay attention to this. This is Gilbert, Arizona. Look at the cost difference, the price difference. At Costco, $4.99. Safeway, $5.96. And if you keep going down, CVS, $27. How crazy is that? $27 at Target, which is CVS, or look at this, Fry's Pharmacy for the same medication, same potency, same dose, 50 milligrams, 30 tablets, $366 versus $5 at Costco. And that is why you really need to look into some of these programs to save you money. Shop around for the best deal, no matter what. So I bring this to you because I see so many patients wasting their money not having this information. So hopefully my followers, some of you, will benefit from this information. In summary, shop around for the best Part D plans annually, Medicare Part D plans, because the price or the cost of the money that you pay every single year varies depending on the medications that you're taking and the plans that you pick. Remember, every year between October 15th through December 7th, you can change plans. So depending on the type of medications that you're taking, put it through the Medicare plan finder, go through the website, and pick the plan that costs you the least every single year. Also, for local pharmacies, if you need medication through a local pharmacy, you have immediate medication needs, go through goodrx.com, goodrx.com. And for chronic medications that you want to save money on and you're paying cash, Mark Cuban's Cost Plus Drugs is a good option. And if you want to go through insurance or if you want to pay cash, Amazon Pharmacy is a good option. All right. Finally, to avoid having to take these medications, to avoid having to take multiple medications, one of the easiest things that you can do is to watch your diet. Obesity and being overweight are horrible, horrible things it increases your risk of so many different things. Sleep apnea, hypertension, strokes, heart attacks. One of the biggest killers of Americans. Unfortunately, in our current system, so much junk, especially food-wise, is being pushed onto Americans. It's capitalism, it's consumerism, but it's killing Americans. I see it in my office every single day with the obesity and being overweight. And I'm talking about a lot of young guys and gals who suffer with this condition. That's something that is not discussed enough, and it is not body shaming. I'm not judging you. I'm talking about this for your health. So you don't have to be on medication. You don't have to be on multiple medications. You can avoid having to deal with any and all of these pharmacy choices and prescription drug plan choices by taking charge of your health. And it's relatively easy for most Americans, for most of us, is what you put in your mouth and how many calories you burn. If you have a net deficit in calories that you ingest, versus how much you burn, you are going to lose weight. Yes, I know there are some conditions, some health conditions where this does not apply, but for the overwhelming majority of Americans, what I just said applies. All right, let me know if you are using any one of these 4 different ways to save money on your drugs, or if you know someone who may benefit, please feel free to tag them or share this video so that they can save a ton of money. As always, if you have any questions, comments, agreements, or disagreements, I welcome them in the comments section below. Thank you so much for the privilege of your time. Please take care of yourself and each other. Bye-bye.